You are listening to That Hoarder Overcome Compulsive Hoarding. I don't talk in real life about having hoarding disorder, so I talk about it on this podcast instead. And because I'm anonymous, I can talk really, really honestly. Subscribe to the podcast and find my social media links, episode transcripts, and every link that I mention at overcomecompulsivehoarding.co.uk. Finally, I am not a doctor. I'm just a hoarder doing her best. So do seek professional support if and when you need it. Hey, how are you? I am well. To tide you over while I take a few weeks off over Christmas, enjoy this previous episode that I know has been popular in the past. If you want to make a storming start in January with de-hoarding, do think about coming along to a de-hoarding accountability Zoom session. There's one on the 4th of January and one on the 16th, and further dates in February and March. It would be amazing to see you there. Okay, enjoy re-listening or listening for the first time to this episode. So I am here today with Dr. Sharon Morein, who is an Associate Professor in the Faculty of Science and Engineering at Anglia Ruskin University. She has researched conditions and behaviours such as OCD, ADHD and hoarding. She also leads the Morein Lab, where the research integrates experimental psychology, psychiatry and cognitive neuroscience, with a focus so far on OCD, ADHD and hoarding disorder. So, Sharon, what piqued your interest initially in these particular areas of study?
I guess circumstances. It's, when you ask people how they end up doing what they do, and there was never a plan to do it. It's just areas that kept cropping up. And I kind of fell into doing research I was going to do something else. And then sort of the ADHD angle keeps coming again and again. And the same, not just for the mental health conditions that I'm involved in, but even the topics that I research. I'm going to go and do X and then I end up doing Y. And then 5 years later, I'm still going to do X and I get dragged, end up doing Y. So it's not particular. It's chance, and once you're faced with understanding the complexity of something like OCD or ADHD or hoarding, then you kind of it's a huge puzzle or problem, and just you spend all that time trying to figure it out from different perspectives. Then you're kind of emotionally invested in it now.
And I guess the more you learn, the more you realise there is to learn.
Oh, totally. The more you learn, the more you don't know anything. Absolutely.
So I got in touch with you after I read your article called Hoarding, People with ADHD Are More Likely to Have Problems, which I will link to on the website. Now, I found this really fascinating. I'd read speculation about the two conditions co-occurring before, but your research felt far more definitive than anything I'd seen before. Could you talk a bit about the research you did and what you found?
Yeah, so I'm happy to expound on that for hours, but just stop me or interrupt. I mean, the background is actually coming from OCD. So sort of, and as you probably well know, hoarding disorder kind of came about after being under the umbrella of OCD for many, many years. And then only in 2013 was it recognized as a thing in its own right. And, you can definitely have hoarding disorder with not a shred of OCD. You can have OCD with not a shred of hoarding. Yes, there is overlap between the two. Some people absolutely have the two. Some people have the two where they're interconnected. Some people have the two where they're completely separate. So that's one of the things that I personally keep tackling is the complexity of people. People are just so bloody complicated. But coming out of the OCD literature, or at least out of the hoarding literature, it's sort of it's a thing we know, or people who are interested in hoarding disorder, that there's this. It's not even anecdotal anymore, but it started off with anecdotal stories. You're sitting in a support group. There are, on average, people that are in their 50s or 60s, so not young people. But and they reflect back and they say, if I was 16, I would have gotten a diagnosis of ADHD, or actually, I think I had ADHD all my life. I'm only now on this journey of self-discovery do I realize that's been a problem, that I've always had. And when you try and figure out what it is about ADHD, it's kind of this idea of inattention. And inattention is a very sort of umbrella broad term. It's not just difficulties concentrating, it's things like difficulties organizing, difficulties planning. There's a huge element of procrastination there because it's just so difficult to get your act together kind of in an organized, on it way. So there's a lot of components that fit into inattention when we use that word from a research perspective. You kind of have to unpackage it. But those are the kinds of things people talk about. They don't talk about, being hyperactive. Some of them probably were, but, they don't talk about being hyperactive. They talk about this problem of inattention, daydreaming in class, the classic kind of stories. But it's all retrospective. It's all kind of, what I was, all those decades throughout my life. Now, there has been research where it was said, okay, let's look at these people who hoard and let's see if they do have these problems objectively. And it turns out many of them do. So that's another thing. You can never say all the people all the time. We're saying sort of on average, compared to another group, many people in this group, will have it more on average. And of course, there's a whole spectrum in the group because you've got people that, with hoarding disorder that have not a shred of problems with inattention and people that have quite severe inattention. But as a group on average, yes, they do, compared to age-matched, a similar group without hoarding. So there is merit to that kind of. It's not just anecdotal. We know that there is a link there. And then when you go into the research, there's a hint of that connection. I mean, one of the problems with the hoarding disorder is you are talking to 50, 60-year-old people that are telling you, what they've had throughout their, you don't know if they've had ADHD because they weren't diagnosed. And seeing somebody, 3 decades into, their adulthood, all things of manner have happened to them. You don't know if because of their circumstances, they have these problems with inattention. So it's limited in what you can say about the connection. And also there is research where you go into a big population, I don't know, thousands and thousands of people, and you ask them very, very little questions. So you'd ask them a question about eating disorders and a question about OCD and a question, but not in depth. And so when we do these kind of large scale demographic studies, so when people have done that, then the people that say, yes, we had ADHD when we were kids, and yeah, we have some hoarding problems now. So you do see a bit of a connection, but it's based off of, 1 or 2 questions.
Yeah.
Which isn't really, it doesn't give you a lot of insight. It's suggestive, but it's not definitive. But all that's coming from the hoarding disorder literature, where this connection is established. It's well known. But if that's true, that these people who hoard have a problem with inattention as linked to ADHD, what about the other direction? If you've got a direction going from A to B, it doesn't mean that you have the same connection going from B to A.
Yeah.
It's not a given. And I'll give the example I like to give is eating disorders and OCD. So if you go to an eating disorders clinic, a serious minority of patients, at least 30%, probably more, will have OCD. Right. So they do have those characteristics. On the other hand, if you go to an OCD clinic, you'll see eating disorders, but not at those crazy levels. So it's not bi-directional. It doesn't go both ways. So the same question here, you can say, okay, well, if we trust the data that we have so far, and people with hoarding disorders on average have this inattention problem. We know inattention is kind of part and parcel of ADHD. I mean, it's in the name, right? Attention deficit hyperactivity disorder. What does it mean about going the other way? So that's one reason you think, okay, then it makes sense. Somebody really ought to go into an ADHD clinic and actually ask about hoarding. But there's another component here, and that is the age difference. And that is when you go to those support groups, again, you will see younger individuals, but the average age, let's face it, is 50s, 60s. And certainly when you do research, you're trying to get people to participate in your research. Time and time again, if you just open any paper and just look at the ages, it tends to be 50s, 60s, if not older. But then when you talk to people, obviously they didn't develop their hoarding disorder when they were 55 or 60. It's been there for a while, certainly. And when you ask people about, when did it start, they do tend to say, 20s. in the least, sometimes late teens. So there is sort of an acknowledgement that this thing has been around for a long time, but we can manage to pick people up just from a practical perspective to do studies. We manage to attract people in their late 50s, 60s. And the other thing that is kind of complicates is when you go to the support groups or when you look at these at the published papers, and this was certainly true for my research experience as well, you get more females than males. You get more women or people that self-identify as women rather than men. And there are conditions where it is more biased to one of the sexes compared to the others. I mean, autism being a famous one, where, just on average, you're going to get more males than females. And then, depression, for whatever reason, you tend to see more females than males. So it could be that hoarding just is one of those where there's more females than males. But if you remember those old or those studies where I said, you just ask, a few superficial questions, it turns out that there's no difference between the males and the males. Sorry, the females and the males. So they're not gender biased. It's not a condition that's gender biased. And OCD isn't either. So then why are we seeing all these females come forth and agree to do the studies and come to the support groups? We see males, but not the same proportion. So where are all those younger males, I should say, and where are all the young people in general that hoard? Do they not seek help for any problems? If they have inattention problems, then we can pick them up maybe in the ADHD clinic because they're going to complain about ADHD. So that was kind of the backdrop of why to do the study. It was basically somebody ought to do a study and then nobody wanted to do it. And I was like, oh, right, well, if I get funding, I'll do it. And if I don't, I can't do it. And then I did get funding for it. So I did it. And it was exactly as I described. Go into an ADHD clinic, an adult ADHD clinic, and start asking about hoarding. And that's exactly what we did. So there's a CPFT, so one of the NHS trusts locally, that's Mental Health Trust, and it runs an adult OCD clinic across several local towns, including Cambridge and Peterborough and Huntingdon, and basically asked everybody in the clinic to please take part in the study. Not everybody did, obviously, but when we asked about the study, we didn't say, we're going to do a study about hoarding. Do you hoard? It was a bit more subtle than that. We couldn't lie, but we kind of just talked about accumulation behaviors and tried to keep it vague for people going in. And we just asked a lot of questions. So it was self-report, but we kind of asked using multiple tools. So we asked about depression, we asked about OCD, we asked about hoarding. We asked about hoarding from different questionnaires using different tools at different times in the study. We asked about all manner of things, perfectionism, because that has been, from a research perspective, been a thing that may or may not be connected to hoarding. So we asked about all these things. And when we did exactly the same procedure using exactly the same sort of wording and type in a similar group, which we tried to match as closely as possible. So we did manage to match it for age and gender and education. So they're actually quite closely matched on those characteristics. And the idea is, let's compare. We're not just looking in one group, we're comparing it to the other group.
And those are people who don't have an ADHD diagnosis.
Absolutely. Yeah. So we were very careful to sort of screen out any shred of ADHD in them. And then we compared the numbers. The other thing is, because we were basing it on self-report, you have to be a bit careful because people can just say, yes, I have everything. But what we did is we cross-referenced, and you had to report high levels of hoarding in different tools. And you had to have a high level on this and a high level on that and a high level on the other one. So you had to consistently complain about hoarding characteristics across multiple. And it was quite a strict kind of, we're not going to believe just anyone who says, yes, I have a lot of clutter in my house kind of thing. And we ended up in the ADHD group, which we managed 90 people. So I would have loved way more than that, but that's kind of who agreed. 20% had cut, we're talking quite severe, as in they would qualify probably for a hoarding disorder diagnosis. So the same exact procedures, same analysis, same everything. In the control group, I think it was about 1.5%.
That's a vast difference, yeah.
Which is what you were expecting in the population. So when people have gone into the population and figured out how much hoarding disorder there is, you get 1 to 2%. And I think we were on the lower end of that. But remember, these people have been screened out for ADHD. So they were kind of a relatively healthier than average group. So they were quite mentally, probably, lower on the end of mental health issues in general. So yeah, vast difference. So that's one thing. So there's 20% here and 1.5% here. And then the other thing is we did look and say, okay, this 20%, in what way are they different from the other 80%? So the ones above the threshold. So in a sense, you've got a threshold or a cutoff, and you're saying, okay, people with really bad hoarding or reported, lots of distress and issues, they're going to be above that threshold, and you've still got the 80% that are below that wouldn't qualify, or we don't think would qualify for hoarding disorder. And when you compare those two, you see that the people above the threshold have a lot more problems in inattention. So they're all ADHD, but again, you've got a continuum of inattention. So the ones above have worse inattention, and again, the broadest sense of the word, and they have lower quality of life. Surprise, surprise. And these are tools that not we collected, but we got permission to use their data. They gave us permission to use the data from the clinic. So we could see, they were more medicated, they had more SSRIs, they had more issues, let's say. Yeah, the bottom line was they had worse inattention, not hyperactivity, not on all the other aspects of ADHD, and the quality of life. And the other thing is they weren't that much older. They were in their 30s.
Right.
And there was an even split of males and females.
Interesting.
And that's kind of different from what you'd see in the hoarding literature, where I said, they tend to be older and predominantly female. So in that sense, we were reaffirming what you could deduce from the big scale demographic superficial studies, that actually you do have a rough similar gender ratio. And yeah, surprise, surprise, you don't develop it in your late 50s.
Yeah.
So that's where that one is. Then another thing that I think is interesting is we still looked at the 80%. So those below the cutoff or the threshold. And we said, well, what about these people compared to, the controls that were below the cutoff? And they still had more severe hoarding. It wouldn't be as bad as clinical levels, but they still had more issues on average. So many of them were fine, but then many of them wouldn't qualify for hoarding disorder. But, it's all along a continuum. So in that sense, I think there's sort of a sub-threshold kind of issue that I think probably some people with ADHD face. And then the thing that, as we've been talking before, this issue of insight is when you look at the clinical data, who reported what issues, because when they come to the clinic, you have, a full picture of, what other conditions they had, or, the medications they had, all these other components to their lives. And only one person in the clinic was actually diagnosed with hoarding disorder.
Right.
So a lot of them were diagnosed with depression, there were eating disorders, binge eating disorders, autism was another one. So obviously when they come to the clinic, some people only have ADHD, but other people have ADHD and something. And only one had hoarding. But then I think it's an issue of raising the topic yourself versus being asked, just random questions about your clutter, or random questions, does your room look like this? Or how do you feel about throwing things away? Then you can answer it truthfully, I would say. Well, it's not an issue of not being truthful, but you just answer the question without thinking too much about, do I have a hoarding problem? You just answer the questions.
Yeah.
But if somebody asks you, do you have a hoarding problem? Then you're probably going to say no.
Yeah, and that can be because that's not a label you identify with, or it can be because it's such a stigmatized label, people don't want to say yes to it. Whereas saying, yeah, I do have a bit too much stuff, or yes, I have trouble throwing things away, is less of a loaded question, feels less loaded.
I think it's also, I don't know how it gets asked routinely in healthcare these days, at least in the UK. It could be that, it's phrased in a way where people are just less likely to say, yeah, that's me.
Yeah, you're not a hoarder, are you? Or something like that.
I don't think they ask that. But I think when people start using the word hoarding, it's maybe there's a certain portion of people going, no, that's not me. or that doesn't speak to me.
Yeah. So I'm really interested in cause and effect. Would you say that somebody having ADHD could lead them to hoarding, or could it be the other way around, or could it just be that the two things co-occur without one causing the other?
Yeah, I mean, it's a great question. So the way that I envision personally, it's not a theory, it's not, it's still early days, but the way that I look at hoarding is you've got these different components. It's almost like a recipe, and you throw in, you've got some sweet stuff and some sour stuff, and you just throw in, you mix it all together. And one component is this inattention aspect, which you can call, difficulties organizing, difficulties making decisions, concentrating, all those things that I referred to before. And there's lots of them, but they're all kind of under that umbrella of inattention. And I think if you do have problems like that, then it will increase your chances of eventually having clutter in your house, maybe having to go through, documents accumulate in all our lives. But you need that wherewithal and say, right, I'm sitting now and I'm sifting through all this pile of mess, and I'm going to organize it and not let it, get ahead of me. And that does require something that I think many people with ADHD would find challenging. And it's the kind of thing where the more you put it off, the more challenging it can become. So you can imagine some people with ADHD living in a more cluttered environment, trying to organize their stuff, putting it in piles everywhere, and they're not really sure what's in each pile or how to cope with the piles. So you can see the connection there from a kind of cognitive perspective. Yeah. But there's another component there, which I'm not sure is addressed enough in the ADHD literature. I mean, it is obviously addressed, but that is the emotional component. And we know that any adverse life events, any kind of, personally traumatic issues will increase any mental health condition. But I think there's a special connection with hoarding. And that kind of relates to maybe that, the technical term is sort of, I think, excessive attachment. But that idea of having that emotional aspect. And I guess a lot of things when we talk about mental health, I see everything in shades of gray, or I see things as continuums. Everything in my head is like, people vary in along continuums and stuff. And so many people will have a childhood, safety attachment object, your favorite blanket, or your teddy from when you were 5, and it's even like the stuff that belongs to your loved ones. So you'll see a lot of parents keep, their child's first whatever, and have all this emotional attachment. Now, it's just an object, it's just an old T-shirt or what have you. But, my mum saved this dress of mine from when I was 4 or 3. It's just a dress. It's a tatty old dress, but obviously it means so much for her because of the memories and emotion.
My mum's still got our teeth, first baby teeth.
Yeah, absolutely. So I think there's an aspect here that most people can resonate with. Yeah. That thing of that extension of something to emotion and that sense of belonging or attachment, whatever you want to call it. Now that's along a continuum. So we've got those things where I think a lot of people can either nod because they've experienced, or they nod because they can relate to it, or they know somebody who will have. You extend that all the way to sort of, with hoarding, people can report strong attachment to things that many people wouldn't really get why you're attached to these pieces of paper or these, things that maybe somebody else would say is trash. You'd be horribly offended, and you'd say, no, that isn't trash. But you don't get that same sense of understanding that you had with, the childhood teddy bear and your children's first curl and that stuff. So that aspect of attachment, you can think, well, I get the attention in the ADHD side. I don't necessarily get the attachment side. But I think some of that is probably that you do sort of the attention bit is kind of priming you to be sensitive to this. And then if you end up in a situation where you've had an adverse life event, or you've experienced adversity, it can tip you over. And so one of the things we didn't do, and somebody should be doing, is going back into the ADHD population, and first of all, seeing again whether it's there. So, and as an aside, an interesting thing is some people in the hoarding, they were like, yes, we knew this was going to happen. Thank you. Like it's an interesting study. Some people were like, oh, it's obvious.
Yeah.
I was like, well, it's not obvious. Nobody actually looked at it. But yeah, okay. You've looked at it in people with OCD and hoarding and ADHD, but that's not the same as just looking at the other population. So that's kind of the sentiments you get in the hoarding disorder literature. I have to say that the ADHD literature is kind of agnostic in the sense of we don't entirely believe this. We're very suspicious of it. And that really speaks to this, I think, compartmentalization of how we view mental health, because we do it by labels, right? We say you have OCD, you have hoarding disorder, you have ADHD, you have X. But at the end of the day, it's the same person. Like a person can have A and B, and actually not a full-blown hoarding disorder. Maybe they have some flavors of it. So as I said, the real world is messy. People are messy. They don't come with like nice little squares and nice labels. World doesn't work that way. But the way we make sense of the world works that way. We put our labels, and we put things like, even gender, we put male and female. That's a societal thing. It's not a biological thing. When you go to the biology, it's all messy and it's much more gradations and continuums and stuff. But as a society, we need the labels. And I think that's true also in mental health. We need the labels. So coming at it from that perspective, I think there's a lot of work to be done in the ADHD community, firstly, of understanding where hoarding fits in. And I think it's more than the average population without ADHD. I think there really is a genuine connection there. But, I think more research we always need to go and do it again and again and just see how stable it is. And, I did it in the UK. What happens in North America? What happens in, I don't know, China?
Yeah.
What happens in other places? We don't know. We genuinely I don't think anyone knows at this stage. So there's that to be done. And when that's done, I think that side of emotional attachment needs to be explored much more fully. There's one interesting study. It's a qualitative study on just a very, very small number of children with ADHD who their parents said have hoarding issues. But it's a very, very, very small number. And they interviewed the parents. And one aspect of the hoarding that they complained about in their children or talked about in their children was excessive attachment. So it does seem like that attachment issue is part of this hoarding, the array of hoarding symptoms that you see in the ADHD group as well. But we don't know yet because nobody's looked at it. So that's something to look at is the attachment issue working the same way in the ADHD group as it's working in people who just report hoarding without ADHD? I don't know yet. I suspect it does, but we don't know exactly how it works there. Yeah, and then the issue of insight as well. We don't know we don't fully understand it within the hoarding community or within, people who hoard with no additional issues. We don't fully understand it there. So to understand it in the ADHD group is again something, because people did endorse it. Once you ask them about clutter, they say, yes, I do have clutter. But I don't think they really picked up on the fact or said, yes, we are people with hoarding issues. I mean, the interesting thing as well is they were in their 30s.
Mm.
And as I said, there is a gender issue. And I think the gender issue is related to insight.
Right.
So I think women, for whatever reason, it could also be a role of society. We know women seek help for mental health issues on average across the board more than men. I don't know. It's still early days in terms of how that's playing a role.
I wonder also whether just society's role that women are meant to be the clean and tidy ones makes women more conscious if they're not.
Could be. It could also be the environmental thing, right? Because you've got children, you've got you're expected to take care on that level of cleaning, feeding, and stuff a bit more. Then I think it would come to the forefront.
I know that your work is research and not therapy or treatment yourself. But if somebody who is listening has ADHD or suspects they do, as well as hoarding disorders, is there any research or knowledge about how they can progress, how they can try and improve things?
Yeah, I mean, first of all, I mean, it's in the UK specifically, you can go to your GP, have that conversation. I think nowadays getting on a list, getting to see a psychiatrist is going to take some time, but I still think it's a worthy pursuit, as in talk to a professional. That's their job, right? It's their job to diagnose and to provide support. So, and I do think that the way society operates, sometimes having a label can be valuable. It can be valuable, if you're a student, you get extra time, there are certain places where you can invoke it, where it can help you. And I think also on in terms of self-understanding, thinking that I have a problem and then somebody else coming and saying, yes, you do have this label is a separate thing. And for some people, that is helpful.
It's validating, isn't it?
Yeah. I don't think, again, to everyone, but I think for many, many people, it is validating, and it helps to make sense of yourself. Do I have A? Do I have B? No, you have B. So that puts you in a position where you can come to terms, I think. And that's one thing. Personally, I've learned a lot from charity websites. There's charities that I think are really helpful. Even the NHS website, to be honest, has got quite useful and objective data, with no agendas in it. But there's lots of charities that I think have really useful information. And they also have offers of support, so even helplines, or if you just want to chat and get to terms with that. And that's true certainly for the ones that we've mentioned, like OCD and hoarding and ADHD. They all have great websites, and it's because the internet is worldwide. You're not limited to the websites in your own country. So I personally found that the websites for IOCDF, which is I don't know if you remember the exact initials, but
International OCD Foundation.
Yeah, so they've got stuff obviously on OCD, but they've definitely got stuff on hoarding, a lot of it.
Great.
And a lot of useful resources. So it's free, as far as having internet connection, and there's just knowledge is power in that sense. There's a whole area of therapy called psychoeducation, which just means you learn what we know about this, and it helps you make sense of what you're experiencing and what's normal and what other people are experiencing, and just reference yourself compared to other people. So that's something people can do very easily. Another thing is support groups are not for everyone, but there are quite a number of support groups. In the last 2 years, it's also easier to transcend geographical barriers, in the sense that if they used to meet in this room on this day at this time, now if you find somebody who's organized, so many of them are on Zoom or done remotely. If you find a right group and you happen to be 2-hour drive or 3-hour drive from someplace, if they're amenable for you to join. And I think sometimes people think that trying something is like a commitment for life. And it's not. It's true for medication. It's true for therapy. It's true for support groups. It's even true for labels. Even if you get a label like OCD and you have it now, it doesn't mean it'll be your label in 10 years.
Yeah.
It'll be part of you on some level, but you may not fit the bill for OCD in 10 years, or hoarding or what have you. People change over time. So you can take a medication, you can try a therapy, and some therapies aside, like SSRIs, which you're going to need a couple of years or a year commitment, but so many other medications, especially things like ADHD is the number one. Try it for a few days. Works, wonderful. Doesn't work, don't. You don't have to take it for years on end. Yes, you can commit to a process where they change it and augment it, and that will take some time. But even then, we're talking months. We're not talking, give it 3 months, doesn't work, goodbye, thank you. Works only in certain conditions, take it then and don't take it elsewhere. So that's true for some medications, not for all of them. But it's also true for therapy. Go for therapy, take what you can out of it. Especially things like CBT, they're meant to give you tools.
Yeah.
And it's not a one size fits all. As I said, people are messy, people are different. Some tools, some tips you use, and they're going to be brilliant for you and you can use them for decades to come. And then other things are rather useless for you. But then, bloke next to you is going to find that thing absolutely useful and they could be useful for a few years and then not be useful anymore. And that's okay too. So that idea that, things have to be forever, it's not.
Yeah.
It's how it's working out right now. And if not, then not. It's okay. You give it a try and move on.
I used to be very rigid with my thinking. Like, I would read some advice and I would try it. And if it didn't work, I would go, that doesn't work. And it's relatively recently that I've started going, well, does some of it work for me? Can I take the useful bit and abandon the rest? Can I adapt it a bit? And it doesn't have to be, there's nuance. There's more nuance than a lot of people approach the world with. And it's relatively recent for me.
Yeah, absolutely. I think it's not easy always to do, especially if you're going to commit to doing something. Like, I'm going to apply this technique in my life. I have to be serious about it. I have to think.
Yeah.
I have to be committed. Yes. But even when you're committed, you can commit to doing it for, a week, 2 weeks, 3 weeks, a month, 3 months.
Yeah.
And then, and make a decision. I mean, I've decided now to take up yoga because I need something that is, low energy and relaxing in my life. And I just can't commit to meditation. But I was like, okay, I can do yoga. So yesterday I went to the first yoga class I've been in for years. And before going into the class, I said to myself, I am going to do 4 yoga classes before I make up my mind of whether I am going to be doing yoga for the next year or so or not. And I'm not going to make the decision based on the first lesson. I'm committing to 4. But if after 4 I'm not happy with it, that will be the end of it.
Yeah.
So that's my way of coping with trying out new things based on my experience. But again, that's my way. Whatever works for you is whatever works for you. But I think it's also having that discussion with yourself.
So what is next in your research? What do you still want to learn about hoarding disorder and the related conditions?
Oh, there's so much. Yeah. So as I mentioned, this issue of emotional attachment is something that I think needs to be understood. I mean, going back to the ADHD side, one of the things. So this isn't the only study that I've worked with ADHD in the last few years, but because I do stuff with the OCD side, obviously I ask similar questions. Now you expect the people with ADHD to answer differently. And indeed they do on some things. And then they answer similarly on some questionnaires. But then you think about, why did they answer that? And the reasons that they answer are different from people who have hoarding or people who have OCD. And that's something to say about the questions that we're asking, where we're kind of asking the question and we're just interpreting the answers in one way, but actually the answers are so much more layered, or they're coming from a different way. And one of those is kind of self-doubt, which I think is really, really interesting. So OCD has been characterized as the disorder of doubt. Like, it's a massive thing in people with with OCD. Not all of them, obviously, but there's a massive component of self-doubt here. And I think one of the things is it's often not justified, right? It's like, did I close the door? Did I not close the door? I've got a bad memory. You don't have a bad memory. You've got OCD. That's what's going on. But when you ask people with ADHD whether they doubt, they also say yes. But I think there it's different. It's different because if you've grown up, and remember, as things stand right now, to have a diagnosis of ADHD, you've had to have it since childhood.
Yeah.
And we're talking about people who are adults. So those are the people I work with. And that means you've been carrying ADHD around for quite a number of years. And so by virtue of having ADHD, you're going to doubt yourself, right? Because you have problems with inattention. It's not, with OCD, people think they have a problem, but actually on average, they don't. They don't have worse memory. They don't have worse attention. I mean, it could be that they have worse attention because of medication or other things. And again, everybody's different. But having OCD doesn't mean that your attention is worse. Whereas actually having ADHD does that. It's part of that condition. It is part of the symptoms. And that will lead you to self-doubt, not because it's part of the condition, not because you doubt the reason you doubt yourself is different. It's because you have problems.
Yeah.
that's something I don't think is fully explored in the ADHD literature, of that consequence of having ADHD all those years. It makes you different.
Yeah, I'm thinking about an account I read by a guy with OCD, and for him it manifested as when he worried that he had run someone over when he was driving and not noticed. He'd hit somebody with his car. And he would be fine when driving, but then he got home and would worry so much that he'd hit someone with his car that he would go back out and re-drive the route to check there was nobody in the road. And I was thinking of that when you were talking, because in that case, the evidence in terms of you'd feel it if you hit somebody with your car, or you'd know about it. So all the evidence can reassure him that he didn't hit somebody with his car. But if you have somebody who's spent their life being told that they're not paying attention,
exactly,
then all the evidence for them is that they're not paying attention.
Yes, that is exactly the difference. And that's sort of, asking somebody, do you doubt yourself? Both people with OCD and both people with ADHD on average will say yes more than sort of control groups. But the reason that they doubt themselves is completely different. And I think that hasn't really been explored fully and understood, that, the reasons underneath stuff. And I think only if you look at multiple disorders do you start seeing the similarities and differences, and why are they similar, and how are they different, and why are they different. That's something that really fascinates me, this comparative issue. So yeah, that's one thing I'd love to explore. And then the other thing is insight, which is this thing where I think one of the reasons we don't see younger people who hoard, even though they, in your 30s, you are definitely having hoarding issues.
Oh, I was clear. Yes, I'm in my mid-40s now, but certainly in my 30s it was well manifest.
But you don't see 30-year-olds on average. Again, you see them, and apparently, you might increasingly see them. But up until now, on average, we still see more 50-year-olds than we see 20-year-olds or 30-year-olds. And the question is, why is that? Is it that it takes time for hoarding to develop, to get really bad? Is it that there's an issue here with self-discovery or self-insight? Is it both? That's, again, something that I think could be explored more. And that issue with the gender, why is it that we see them more females? Is it that there's an issue of insight more in the males? Is it something to do with society? Don't know. So those are just a few of the issues where I think looking at it more closely could help.
So where can people find out more about your work?
So the paper is published in an academic journal, so it's been peer-reviewed and published. So the conversation piece is sort of, again, on a website, freely available.
I will link to that in the show notes.
And then if anybody actually wants to read the actual research describing exactly with all the numbers and stuff, that's also actually freely available. So they're welcome to download that and have a look if they're interested.
So thank you so much. It's been really interesting hearing about your research and what it could mean. I think it could, have a really potentially useful impact in the way people are treated and understand themselves.
Great. Well, thank you for having me.
In just 1 second, I'll give you my top tip of the week. In the meantime, please do subscribe to the podcast, review it, 5 stars would be amazing, and share it with your friends or anyone who might be interested or who might benefit from it. It all really helps. To find more ways to support the website, the podcast, and my overall de-hoarding project, go to overcomecompulsivehoarding.co.uk/support. Now, back to your top tip. So my top tip this week is actually from a listener who wants to remain anonymous. They said, I have a tip that might not help you but might help other people listening. My apartment can get out of control because in addition to disorganisation, I have disability. I have a trash grabber that people use when they're picking up trash on the side of the road. When I'm physically exhausted and can't bend down, I use it to pick up trash that ended up on my floor. Sometimes it's kind of fun to use, so I end up picking up a lot of trash just because it's fun. In addition, I can pick up trash while doing things like using the bathroom or soaking my feet. Sometimes I need to sit down, but there's enough trash within the reach of my grabber that I can still be picking up things on the floor while sitting down. Now, they also went on to say, however, I know it's another thing to buy, so it's important to think through if you'll actually use it or if it will just add to your stuff. So thank you, listener. I think both parts of that are important. Sounds like it's massively helped you and it may well help others, but also don't let it just be another acquisition that sits in your home and adds to your clutter. Okay, thank you for listening, and I will speak to you next week. Thank you for listening to the Overcome Compulsive Hoarding podcast. You can find more online at overcomecompulsivehoarding.co.uk. You can find me on Twitter at @thathoarder and on Facebook at Overcome Compulsive Hoarding with That Hoarder. To find out more about how you can support this podcast and the overall project, go to overcomecompulsivehoarding.co.uk/support and do subscribe to this podcast so you make sure you don't miss any future episodes.